How is the testicular cancer diagnosed?
Clinical examination is clinching in many situations. Once a doctor suspects a patient to have a testicular cancer, a series of blood tests are conducted wherein we evaluate certain markers, what we call as the tumor markers. These tumor markers are elevated in more than 70 to 80% of all testicular tumors. However, there are some testicular tumors which do not produce an increase in these tumor markers, but by and large, all patients with a suspicion of testicular cancers must be screened with these blood tumor markers. Subsequently, we also do an imaging, most of the times a CT scan of the abdomen and pelvis, including the affected area, the groin, and then, if required, also a CT scan of the chest. This typically completes the evaluation of the testicular tumor, and with these pieces of information, we can not only diagnose a testicular tumor, but we can also stage it. However, unlike in almost all other cancers, where we typically perform a biopsy to confirm that a patient has a particular type of cancer, we do not usually perform a testicular biopsy to document testicular cancer. In fact, by doing a biopsy on the testis, we can potentially upstage the disease. So this is one exception that we need to know and we need to be careful about while dealing with evaluation of testicular cancers. So a biopsy is not the standard of care and should not be performed. So whenever the doctor suspects a particular patient to have testicular cancer, the doctor will proceed with the treatment, which in turn also offers us to evaluate the patient further with the pathology reports. So, to conclude, testicular cancers can be diagnosed easily by clinical examination and with basic blood tests as well as a CT scan.
So, as we know, we have something called breast self-exam for dealing with the breast cancers, and I would like to ask if a self-exam of the testis is recommended for testicular cancers.
The incidence of testicular cancers are extremely low. So, unlike the breast cancer, which is very, very high. So, in general, the yield by doing a self-examination of testicles in all men may be a little superfluous because the incidence of cancer is very low, and therefore, as such, there is no standard policy for recommending a testicular self-examination in all men. However, I think it is quite okay for men to examine themselves once in a while to ensure that both testicles are normal in size, and that should be it. Self-examination of testicles, however, is very, very important in certain group of individuals. Number one, in men who have had a family history of testicular cancers, like in those where the father or one of the other brothers have had a testicular cancer, these men can self-examine themselves to ensure that there is no testicular cancer developing in them, because there could be a marginally increased risk of testicular cancers when there is a family history. Men who have had a testicular cancer, because we have two testes. So if a patient has had a testicular cancer in one of the testes and has been treated, he should be examining himself to ensure that the other testis is healthy. So men with a past history of testicular cancers should undergo a testicular self-examination. Men with cryptorchid or undescended testis who have had a corrective surgery done, where the surgeon has brought the testis back into the scrotal sac, should be compulsorily encouraged to do a testicular self-examination. Like I mentioned to you before, that's one of the major risk factors, and therefore the very purpose of bringing down the testis is also to do a self-examination, and therefore these men should also be constantly involved in a testicular self-examination. Barring this subset of people, there may not be a major diagnostic advantage by routinely recommending a self-examination of testicles to all men.
Since we know about all of this, next we come to the question of how this testicular cancer is treated, and I would like to ask, what are the different treatment options that are available for this cancer?
Yeah. So testicular cancers, like I discussed before, affects men in their peak age. It is important for us to know at this point in time that testicular cancers, though occurring in a young age, have probably the highest possibility of cure amongst many organs. When we look at it, the cancer cure rates are as close to 100% as possible. So the treatment options for testicular cancers are excellent. And a vast majority of men who are treated for testicular cancers appropriately end up being cured and cured forever. Even in a remote possibility of disease relapse at a later stage in life, testicular cancers can still be cured again, and even in advanced stages, testicular cancers have a very high cure rate, upwards of 90%, to an extent where we do not have a stage 4 in testicular cancer. Unlike the conventional 1, 2, 3 and 4 stages that we assign to all other cancers, even in the most advanced stages, we still call them stage 3. And that implies that no matter how much the disease has spread, the propensity for cure is very high. So this is something that I want to share with all the viewers today, that even in the untoward incident of having a testicular cancer in a known person, there is absolutely no need to fear. Now, testicular cancers are broadly grouped into 2 subcategories, what we call as the germ cell tumors and the non-seminomatous germ cell tumors. We also call them as seminomas and non-seminomas. All germ cell tumors are called seminomas and all non-germ cell tumors are called non-seminomas. Seminomas, majority of the times, are low volume diseases and are amenable to cure with a small surgery where we remove the affected testis. We call this as orchidectomy. If the disease is already spread outside of the testis, then these patients receive 1 or 2 doses of chemotherapy, which is mild, and with just this much of treatment alone are potentially completely cured. Very rarely, if the cancer remains in the lymph nodes, typically in the upper part of the abdomen, what we call as the retroperitoneal lymph nodal enlargement, these patients may also have to receive a low dose of radiotherapy. So the treating doctors will decide of what additional treatment other than a testicular removal is required for these patients to be completely cured. Most of them, like I mentioned, will with either testicular removal alone or with removal plus a combination of chemotherapy will be potentially cured completely or long term. In non-seminomas or the non-seminomatous germ cell tumors, the tumors will typically tend to spread to the lymph nodes in the upper abdomen, what we call as the retroperitoneal area, and sometimes can also spread to other organs or organ systems like the lungs, the bones, and extremely rarely the brain. So depending on the extent of spread, once we have removed the testicles, these patients will invariably require 3 to 4 cycles of chemotherapy with a combination of 3 drugs, and a vast majority of these patients will have complete remission from the disease at the end of 3 or 4 cycles of chemotherapy. Very rarely, some residual disease may remain in the lymph nodes, which may require a surgery called as retroperitoneal lymph node dissection, wherein we remove all these lymph nodes, and this will achieve cure in these patients. Patients having unusual site metastasis like the brain mets may also have to require to undergo radiotherapy to the affected site, but these situations are extremely rare. All in all, the treatment for testicular tumors are excellent. We may require a combination of treatments like the surgery, chemotherapy, and the radiotherapy, which might sound scary, but is mild and most of the times well tolerated because it affects young men who are otherwise completely physically fit. And once they are through the treatment, they just recover and become normal like before.
Young men who are diagnosed with testicular cancer, they worry about the loss of fertility that comes with this cancer. As a specialist and as a doctor, what do you have to tell those men? Is testicular cancer curable?